Are you still confused about the AMSEL's criteria for diagnosis of bacterial vaginosis? So let's try to understand. So AMSEL's criteria for diagnosis of bacterial vaginosis has mainly four criteria. First is a homogeneous vaginal discharge, which is usually gray-white in color. Second, the pH. pH will be more than 4.5. So when you do a litmus paper test, then there is positive whiff test. Whiff test means you take a drop of the discharge and then you add 10% potassium hydroxide. Then you will get a fishy or amine odor. So that is called as a positive whiff test. Fourth criteria is the presence of clue cells more than 20%. So what are clue cells? So when you take a glass slide, add a drop of the vaginal discharge and add normal saline and prepare a smear. When you observe it under the microscope, you will see that the vaginal epithelial cells are studded with cocobacilli. Now, these bacilli sometimes coat these epithelial cells so heavily that the epithelial cell borders are also obscured. Presence of more than 20% of these clue cells is a diagnostic criteria for bacterial vaginosis. Any three out of these four criteria when present is diagnostic for bacterial vaginosis. Remember, the culture per se is not required for making a diagnosis, and the drug of choice for bacterial vaginosis is metronidazole. Even in case of pregnancy with bacterial vaginosis, the drug of choice still remains metronidazole. Also remember that if you prepare a culture and try to see, the causative organism you will get is the Gardnerella vaginalis or the Mobilingus. Stay tuned. I shall also be making a video regarding the differential diagnosis of various vaginal infections, and also a video regarding the normal vaginal flora in different age groups, which are high yield topics for all the entrance exam, NEET, PG or INI-CET, and also as residents you must know. That's it. If you have any doubt, feel free to write in the comment section.